I'm Zara Arboleta at Valley Children's, and we're joined today by Dr. Whitney Kalin, pediatric hospitalist and medical director of clinical partnerships here at Valley Children's. Dr. Kalin, good afternoon.
Good afternoon. Thank you for having me.
Thank you for your time. So for those of you who are tuning in right now, please feel free to leave any comments or questions that you have in the comment section, and we'll get to all of them. But today we're talking about something that many parents no doubt have heard about, and that is the current surge in patients at hospitals across the country for winter respiratory illnesses, including RSV and the flu. Dr. Kalin, let's start off first off kind of with like a state of Valley Children's right now, because you as a pediatric hospitalist are seeing what's happening firsthand. Why don't you explain for folks at home how things are right now and what you're seeing?
Great. So right now we have a giant influx of children who have RSV or any of these other respiratory viruses. I'd say RSV is the number one right now, who are sick and who need to be in the hospital. And so I'd say probably 90% of my patients on any given day in the hospital do have RSV bronchiolitis, and we're caring for them. It's been a very, very busy time for all of us.
Yeah, that's the thing. We are seeing that it's not only at Valley Children's, but at other children's hospitals throughout the state and country. Even our adult facilities, our partners throughout the community are also experiencing high volumes of patients. Any idea why? Because, you know, we have flu and RSV season every year, at least before the pandemic. You know, we expected this. What's so different about this year? Because it's taking a lot of, you see the headlines everywhere, everybody's talking about it. If this is something that's expected, what's different about 2022?
Well, I think probably one of the biggest differences is that we did have the pandemic. And so for several years, most children were kind of protected from RSV and other typical respiratory illnesses. And so we just weren't seeing as many of them coming into the hospital. You know, in the past couple of years, when everybody was masking, washing their hands, kids weren't getting RSV. And so these very young children just weren't exposed to these illnesses. And now every child is basically getting sick with it, you know, right now, that one and all the other viruses that are out there. And so that's why this year is so different.
The majority of the cases we're seeing, as you mentioned, are RSV for people at home, and we are taking questions. We started soliciting these questions last week, and a common question is, what exactly is RSV?
Okay, so RSV stands for respiratory syncytial virus. It is the number one cause of bronchiolitis in the country and around the world. It is a little bit different from some of your other viruses in that it tends to affect the lower respiratory tract, so our lungs and that sort of thing. And it tends to affect the little babies more than anything else. And so it is just a common virus. In some people, it's just a cold, but in the babies and the very small children, it tends to be a little bit more severe.
And that is what we're seeing, hearing from our emergency department teams, folks like you in the hospitalist group, that it seems like the children who are requiring admission are more often than not on the younger side, 2 years and younger, if not 1 year and younger. You want to explain why it seems that it is hitting the littles a bit harder?
So basically, just because they have very small airways and respiratory tracts, we know that the first time you get RSV, often it is much more severe than it will be in the future if you were to get it again. And these little tiny airways just get really inflamed, they get clogged with mucus. And because children have a harder time producing a really hard cough, they have trouble getting that mucus out.
So what are some of the symptoms and signs that people should look out for when they do have a baby in particular at home and they can just tell the baby's not feeling good?
So fevers are actually very common, and depending on the baby's age, sometimes just with a fever, they need to be seen by a doctor. But more commonly, you'll see runny nose, a lot of runny nose, and a lot of nasal secretions. Children will often be coughing. Some children will have vomiting and diarrhea as well.
I know that a lot of parents, so everybody's impacted, hospitals, urgent care centers, pediatricians' offices, general practitioners. When should a parent call their doctor first, and when should they go to the emergency department?
Those are good questions. So just because you have RSV or a baby has RSV doesn't mean something very bad is going to happen to them. You know, most children get through RSV just fine. Sometimes they'll have coughs. A lot of times they'll have runny nose. It's really the children who, you know, start having really high persistent fevers, children who are really struggling to breathe. Maybe sometimes you can see their chest, you know, their chest is moving fast, they're breathing very quickly, or you can see them sucking in like between their ribs, above here, they're using their little tummy to breathe. Those are the kids we really worry about. Also, children who aren't drinking. That is the number one most important thing. And so if it's a small baby, they should be either drinking breast milk or their formula. Those children who aren't drinking anymore, they can get dehydrated very quickly. Sometimes Pedialyte is also an option for these children, but if they won't even drink Pedialyte, that's a concern. So if you have a child who seems like they're having a lot of fevers, they're struggling to breathe, maybe just a little bit, you can always call your doctor, get some advice, maybe go in. And then certainly if you have a child who is very lethargic, like you can't wake them up, they're breathing so fast, you know, they seem like they're just really struggling, those children need to be seen in the emergency room.
Okay, and obviously anybody who is in need of emergency care can come straight to our emergency department, but I know that wait times here at Valley Children's, at all children's hospitals, if it's for a child who does not need urgent or emergency care, they can be very, very long. And so you know, you have these parents, especially new parents, right, where every little thing can freak you out. What do you want to say to those moms and dads who are on the fence and they can't get a hold maybe of their pediatrician or get to an urgent care center? What do you want to tell them when they have their baby at home and they're like, I don't know?
So some parents seem to really be worried about, does my child have RSV or not? It doesn't really matter whether your kiddo has RSV. What matters is, how does your child look? Is your child responding to you, playing? Are they happy? Are they still feeding? Those are the things you should really look for. You know, a child who just has a little bit of a runny nose and a cough does not need to come to the ED for an RSV test. You know, honestly, we kind of assume that most children who are sick right now probably have RSV. It is the #1 virus we're seeing. And so if a child is, you know, if you're just worried, oh, does my child have RSV, but they still look okay, you don't need to come in. Really, the things you need to watch for are, like we talked about, if your child is not feeding or if your child is having significant respiratory distress. You know, some of the things that you can do at home for your kiddo too. So a new parent may not know what to do for a little one who has a cold. The #1 most important thing you can do for your child is suction their nose. And this is most important for those babies less than 6 months, but even less than a year. They're a little bit harder to wrangle at that age, and they don't like being suctioned, but suctioning is the #1 most effective thing. So if a child actually comes to our emergency room, that's the first thing we do for them is suction their nose out really well, because sometimes that alone can make a child breathe that much more comfortably.
And thank you for that. And thank you also for mentioning tests. We're getting quite a few questions coming in about, should I get my child tested for RSV? But I know for a fact, and you mentioned it very briefly, we don't even test every kid who comes in for RSV or flu because it doesn't change how you treat them, right?
Correct. Whether you're positive for RSV or flu, for the most part, it's still what we call supportive care. We suction your nose, you know, we make sure you're drinking well, that sort of thing.
What about COVID-19? We have quite a few questions coming in about what's the difference between the flu, RSV, allergies, COVID-19, and then, you know, if you do think you have COVID-19, should you get tested?
That's a really good question. Interestingly, COVID-19 is not, for most children, is not nearly as severe as RSV and influenza, you know, and so that's why during the pandemic, children weren't nearly as affected as adults because they just don't seem to get COVID-19 as severely. We do test children who are admitted to the hospital for COVID-19 because that affects how we treat them in terms of isolation. We want to make sure we're doing our best not to spread COVID-19 from, you know, one child to another. We do use isolation in different illnesses as well. But the #1 difference I would say is that RSV actually is spread mostly by contact, by surfaces. And so washing your hands is so effective just to prevent the spread of RSV. But yes, the test itself doesn't really make that much of a difference in terms of care because we're still going to suction your nose. and we're still going to make sure you're hydrated and breathing okay.
Yeah, that's interesting. And thanks for putting that in context, because we get, the public relations team gets a lot of calls from reporters all the time. Well, how many positive RSV cases do you have right now? And I give them a number and I'm like, but this is probably just a small fraction of total number of RSV cases. So you talked about hand washing, isolating if you don't feel good. What are some other tips you can give, not only to parents of small children, but just everybody on how to best protect yourself during this winter flu and RSV season?
Right. So to protect yourself, you really should wash your hands or use an alcohol-based gel hand sanitizer prior to eating, prior to touching your face. If you have a small child in your home, you should use a hand sanitizer to wash your hands before interacting with that child, touching that child. We're exceedingly cautious in the hospital about washing our hands using alcohol gel all the time. That's why everybody's hands are so dry. It really is the number one most effective thing you can do to help prevent the spread. Now, if you have a cold or cough, you should wear a mask, especially as an adult. If you're sick, you're going to cough out droplets. And RSV itself, we know is spread more by contact, but other viruses can be spread by those droplets as well. And so that's why wearing a mask is important. Most people still have masks. We wore them all the time in COVID. And so that's why if you're sick, just put on a mask and wash your hands. If you are coughing, cough into your elbow, and try to help prevent the spread that way.
And even better, if your child is feeling sick, keep them at home, right? Don't send them to daycare or to school, because kids are little incubators. Just spread it so quickly. We did get a parent of a premature baby ask, are there extra precautions I can take to protect my baby from catching RSV?
Well, that's a very good question. So certain premature babies actually qualify for a medication called Synagis.
And that's what this parent did mention, that their baby qualified for Synagis.
So Synagis is not actually a vaccine. Synagis is something called a monoclonal antibody. You've probably seen a lot of them on television. They advertise them, but it's only available to certain very ill or premature babies who have congenital heart disease, who maybe have undergone heart surgery, babies who were less than 28 weeks whenever they were born. These babies actually qualify to be treated, because often the premature babies or babies with heart disease, or sometimes neuromuscular disorders like muscular dystrophy, these babies can get RSV so much worse, and it can sometimes be a fatal illness. And so, so first of all, that's one thing you should talk to your pediatrician about. Does my child qualify for that? And then if you can, truly try to reconsider taking your baby out to, very large public gatherings, if at all possible, or make sure that your baby's covered up and no one touches your baby if they're sick. Everybody needs to wash their hands. And I know it's the holidays, people want to get together, but we just have to be a little bit extra careful with these really tiny babies to make sure they don't get sick.
Is there anything that the adults or siblings can do around these babies who are possibly more at risk for complications should they develop RSV or flu? Mm-hmm. Are there things that other people in the household can do in addition to washing hands, maybe gelling in before touching the baby? Mm-hmm. Anything for them?
So there is no RSV vaccine yet, unfortunately. There is a flu shot though. And so we do encourage everyone who is 6 months and older to get the flu vaccine. We know that that will help prevent spread of illness and also the severity of illness.
And that's another good reminder. When people hear vaccine, they think, well, that means I can never get it. So that's why the COVID vaccine failed, because I'm still getting COVID. Mm-hmm. Do you want to explain to people why it is so important to get these types of vaccines and what the level of protection is for you after you get the vaccine?
Okay, so some of these vaccines work exceptionally well. We know things like our MMR vaccine have really high rates of, just making you immune to the disease, and you tend not to get it. Other things like the flu vaccine, the COVID vaccine, even, we know that they are not 100%. They're not perfect. Very few vaccines are, but typically the vaccines really help reduce the severity of illness. And so people who get the COVID vaccine and the flu vaccine, yes, you can still get these illnesses, but you are far less likely to die from the illness, and also to maybe need hospitalization. So those are really big distinctions. Even if the flu vaccine isn't perfect, you probably won't be hospitalized with the flu. That's a big deal.
Yeah, absolutely. We're getting more questions coming in. Someone is asking, how long do RSV symptoms last?
So RSV itself, the kind of the worst symptoms usually are for the first week of illness. Once you're exposed, it can take 4 to 6 days to start showing symptoms. And then typically the symptoms are the first, they can last up to a week or so for the more severe illnesses. You often tend to get a little bit worse before you start getting better. Don't be alarmed, however, if you have a child who has RSV who continues to cough kind of on and off, kind of with some like an irritant cough for a couple weeks even, but the cough is usually steadily improving. Children aren't still getting fevers at that point, and they're acting a lot better.
Okay. Someone else is asking, I do have a question regarding fevers. Do fevers have to be treated every single time, or is it only when it gets to a certain temperature?
That's a good question. So in the hospital, we do tend to treat fevers just because children tend to feel better when they don't have a fever. And so I actually very much advocate for the use of antipyretics, which are medications like Tylenol or acetaminophen or ibuprofen to help with fever. Ibuprofen is safe for children 6 months and older. And then Tylenol, we generally recommend that you give it at age 2 months and older. You can give it to younger babies, but usually a doctor needs to see that baby first. But yes, we tend to treat fever just because the child is uncomfortable. We call a fever anything over 100.4 Fahrenheit or 38 degrees Celsius. And so, no, you don't necessarily have to treat a fever if a child has it. But again, we like children to drink more, and that's the thing we're pushing. And so typically if a child is comfortable, they'll tend to act a little bit better and drink better.
So sometimes if a child has a fever, maybe on the lower end, but it doesn't seem to be affecting their behavior that much, they might be okay. But if they're showing signs, as you mentioned, of lethargy, they're not eating, they're not drinking, then it's time to seek medical attention.
Absolutely, absolutely. Some people are worried about very high fevers. In the hospital, we know that fevers can sometimes get really high with these infections, sometimes 103, 104. Those are pretty high fevers. If a child has persistent, ongoing, every 4 to 5 hours, they're spiking a fever to 104, 105, that's pretty high. And often you should call your doctor or be seen. But if you're having low-grade fevers and you're doing fine, you really don't necessarily need to treat it.
Okay, I know we can't diagnose here during a Facebook Live, but there is somebody who said, I did take my baby to Valley Children's for fever. Apparently the baby had been having a fever for 9 days, but here they didn't find anything wrong. And so the parent is asking how much longer for fevers. My assumption is this parent is probably going, okay, well, I mean, if we're looking at a week and a half of fevers, what do I do? Or is this a case where sometimes kids are just going to be battling persistent fevers for a while?
I think that's a difficult question because yes, some children can get one illness, start to get better, and then get sick again. Generally, if a child has had fevers over 100.4 every single day, for more than 7 days, it is something we do kind of start worrying a little bit about. Can there be something else wrong with the kiddo? And so if a kid really does have fevers for 7 full days, typically we will perform some other testing. We're looking for additional symptoms in those children. Sometimes they can get a urinary tract infection. Sometimes they can have maybe a different type of virus or something else like that, pneumonia. And so generally, if a kiddo is having, documented fevers that high every day for more than 7 days, we do try to figure it out usually.
Okay. So again, for any of you who are watching right now, if you have any concerns, call your pediatrician, your primary care doctor, and see what they say. And if they refer you to Valley Children's, then we are here to help you with that. Someone else is asking, what are some home remedies for children with respiratory illnesses?
All right, that's a very good question. So the number one thing that you should do if your child has a respiratory infection, especially if they're a small baby or an infant, is suction their nose. So any sort of suction that you have is fine. Often when you're sent home from the hospital after having a baby, you're given a small blue syringe, a bulb syringe that you can use to suction their nose. You can use that. There are also different types of suction devices you can get at any sort of pharmacy, Target, Walmart, any of these stores. Something called a nose Frida, things like that. Those are, kind of, I think, the backbone of any home kit for taking care of a sick baby. You need to have some sort of suction. You should also use saline drops. And you can get those at any pharmacy as well. Saline drops, you use in the nose, a couple drops on each side, and then you suction them out with the bulb syringe or the nose Frida, whatever you happen to have. And that tends to help the babies breathe more comfortably. So that's the first thing any parent should do. I think a lot of parents should have Tylenol at home. Again, if a baby's over 2 months, and you've talked to your pediatrician and they've cleared it for you to use that medication, Tylenol is also a really big help, just to help the kiddo feel better. Other things you can do at home, if a child is over 1 year, you can give them some honey. It's kind of a natural remedy. Like a teaspoon of honey can actually help soothe the sore throat and sometimes can help soothe the cough. Honey is not safe to give to children less than 12 months of age, however. So don't do that. We actually don't recommend most cough and cold medications. We don't want to suppress a cough. We don't want to stop a cough. A cough is the only way a child is going to get that mucus up and out of their lungs. And so we actually do want them to cough some. One other thing you can do is add some moisture to the air. So a vaporizer or a humidifier, either one of those can add moisture to the air, and it kind of helps soothe your nasal passages, and it makes the mucus a lot thinner and much easier to cough up. And so, any sort of vaporizer or humidifier is fine. We generally recommend a cool mist vaporizer because they are safer. You can use a warm mist one. You just have to make sure that no steam or hot water actually ever touches the child, touches the baby. They're a little bit riskier, but you certainly can. You don't need to use Vicks. And actually, infants under 6 months of age, we don't recommend Vicks at all. The regular Vicks, they do make a baby Vicks. We do not recommend that for babies less than 3 months of age. You don't have to, but if it seems to help soothe maybe an older infant or child, you certainly can. I don't recommend putting anything into your vaporizer or humidifier like the Vicks or anything. Just straight up moisture and humidity is so helpful for those little inflamed passages. I know when I was sick with COVID, my vaporizer was the one thing that helped more than anything. So those are kind of the home things you can do.
Okay, no, that's good to know. Growing up in a Filipino household, it was Vicks and the Filipino version of chicken soup. And my parents were like, okay, go. So when the kids are older and they can eat more foods, are there certain foods or drinks that can help ease their symptoms, or that you should be giving them more of? Again, for older kids who are already eating solid foods and everything.
So definitely anything with electrolytes is helpful. So for small children, you can actually use Pedialyte in any age range. Pedialyte is safe even for small infants. Generally, when you're very small, we recommend still trying to stick with your formula or breast milk because that has far more nutrition. But if someone is potentially just not feeling up to it, just like you and me, we don't feel good, we're not going to eat our normal stuff. Drinking Gatorade or Pedialyte, again, unflavored or flavored, it doesn't really matter if you're a little bit older. That can definitely be helpful. We want the kiddos, especially if they're not eating their normal foods, to get something with electrolytes and maybe a source of sugar or glucose. You can do juice in older children if that's kind of all they will drink. That is okay, but making sure they're just getting a lot of fluid is really the more important thing. Maybe cutting the juice a little bit with water is potentially recommended too.
Okay, thank you. Someone's asking, does the flu shot help reduce the chance of contracting RSV at all?
It really doesn't. The flu is strictly for the flu. We know that when you're sick with flu, you can sometimes get other things like pneumonia on top of it. But it doesn't directly help reduce your risk of RSV, unfortunately.
Okay. Someone's asking, how do these types of illnesses like RSV and flu affect kiddos with epilepsy or asthma? Do kids with underlying issues like those need to come in right away if they get sick?
Not necessarily. For children who have underlying respiratory problems like asthma, or if you're a premature baby and have something called chronic lung disease, or were a premature baby, we do know that these illnesses may affect you a little bit more severely. The same rules still apply. If you look fine, if you're still, drinking okay, you're still walking around if you're a kiddo, you're still acting okay, you're not having any trouble breathing, no, you do not have to necessarily come in. Now, children with epilepsy, sometimes we know that having fevers can reduce the seizure threshold, which means you're more likely to have a seizure. In that case, I would just say treat the fevers, with Tylenol or ibuprofen if you're over 6 months of age. But no, you don't necessarily have to come in right away. It's just keep an eye out. If you have asthma, hopefully, you have what's called an asthma action plan or plan of what to do if you're getting sick, by using albuterol, something like that. If you have any questions about that, you can always just call your doctor though, and they can give you additional advice on maybe things to do with inhalers if you take them regularly.
Okay, thank you. Some people are just tuning in, so that's why we might be covering some things that were asked earlier, but I think I heard you mention this, but one parent is asking, are products like the electric nose Frida good for clearing mucus?
So yes, any sort of nasal suction device you can get is effective. Some parents feel like they do need to buy an electric suction machine. You don't necessarily have to. A simple bulb syringe can be effective, but the straight old nose Frida, where you unfortunately suck the mucus out with a little filter in there, those are super duper effective. But any sort of suction device you have for the nose will be helpful.
I mean, for decades, all we had were those just regular bulb syringes, which, like you said, you can pick up at a Target or a pharmacy for a fairly good price. Someone else asking, well, we already answered this one. Are there immunizations that can protect my child from influenza? Yes, but not RSV just yet.
Not yet. There's been a lot of interest in creating an RSV vaccine, and I know there are some candidates. Actually, very older adults can get RSV too, and so that's one population that they're working on creating an RSV vaccine. We're all very hopeful there will be an RSV vaccine in the future. However,
is it too late to get a flu shot?
It is not too late to get a flu shot. If you have not had the flu, go get a flu shot.
And then if someone did have the flu, are they okay the rest of the year, or should they get it after a certain amount of time?
Yeah, I mean, so some of these infections you can get again, unfortunately. You typically have a little bit of immunity for a period of time. It can vary from person to person, but we still recommend that you get your vaccines, honestly.
Okay. Someone else is asking, and we did answer this in a roundabout way earlier, but I have heard from other moms that this rise in patients is causing the emergency department wait times to be longer. Is this true?
I would say yes, for sure. I mean, there are just so many people who are sick right now, and so many people have questions. And so if your child needs to be seen in its emergency, come to the emergency room. We do have triage processes in place where if a child is critically ill, when they arrive in the door, they're seen immediately. And so if you can get away with calling your doctor, if it's just a question, that's what I would recommend you do. And if your child is acting okay, but you wonder if they have RSV, I wouldn't bring them in because you're going to wait for a long time.
You bring up a great point, and I think it's probably very important to explain this to folks at home. What to expect when you go into the emergency department. We're hearing a lot of people complaining, and they're like, well, this family came in an hour after me, but their child was seen first. It's not like at a store where you line up and it's okay, you're number one, you go first, number two, go second. Can you explain for our families who are watching and tuning in later too, can you explain how triage works and why it's so important to have a triage system in place in the emergency department?
Absolutely. So a triage process basically kind of categorizes the patient based on their risk of severe illness. And so certain underlying conditions, so let's say you walk in, you have a 2-year-old child, you're waiting, they take your child's vital signs or they find out how they're doing. And this other two-year-old walks in and they're whisked back. Often there is some sort of underlying medical condition or reason that child is taken back. We know that children who have cancer, for instance, are exceedingly high risk anytime they even spike this tiniest bit of fever. So if a child has something like that or some sort of condition that makes them immune compromised, they will be taken back immediately. Sometimes babies, depending on their age, are taken back right away as well. And so, so some people get very frustrated. They know there's a wait time, but typically if your child is waiting waiting a little bit longer and you see someone going before you, it's because there's something else going on where that child has a much higher maybe risk of decompensation or severe illness that has to be treated right away. So that's kind of what triage does, is it looks at the child, how do they look? You know, at some point you'll have vital signs done. Certain types of vital sign abnormalities will get you brought back right away if your blood pressure is critically low, or if you're a baby less than 2 months of age who have a fever over 100.4, those children have to be seen a little bit sooner just because their risk of severe illness is higher.
Thank you. That's a really important message to get out there, because I mean, a child in pain, to that parent, everything is urgent. But it's hard in that moment to see it. But let's say a child comes in perfectly healthy, but might have sprained their wrist or sprained their ankle. And then there's another child, same age, but has an underlying condition or is having trouble breathing. Is it safe to assume that the child having trouble breathing might get seen a little bit earlier than the child who is okay, but fell and hurt their wrist?
Yes, absolutely. I mean, that is, again, what the triage system does, is it looks at the inherent risk of, is that child going to need like maybe a lot of workup, lab tests, IV fluids, imaging studies, medications that may save their life. You know, certainly we want to get to all the patients. The goal is to get to all the patients. It's just, we know that the critically ill ones, or the ones at highest risk, have to be seen first, just because, you know, they may do worse in a very short period of time.
And that's the thing that in talking with other doctors like yourself, with our nurses, it cuts them to the core, that children and families have to wait as long as they do. So I think it's important for you to also talk about how this is not a perfect state for us. This is not what we want either. And it's not easier for us, but your teams are facing extreme challenges with taking care of the influx of kids with respiratory illnesses, right?
Absolutely. Absolutely. We, you know, we have to get to each one of these children, assess their need for oxygen, for IV fluids, you know, for different types of interventions. And so it is very, very difficult, because it's just the number of children with these illnesses is much higher than we've had, you know, for really the past 2 years, for sure. One other issue is that, you know, this season came a little bit sooner this year. And we're also seeing, you know, you know, as part of what I do as a hospitalist, we tend to see like this virus and this virus and this virus. Right now, the viruses aren't following the rules. And so we're seeing all of them all at once. And so sometimes children are coming back and wow, it's their third, you know, virus in a very short period of time. And just when you have the sheer volume of kids sick all at once, it's really hard. And so, you know, if your child is waiting a little bit longer, usually it does mean they're not doing as badly. And so that is, I mean, I know it's easy to say, and you're going to be frustrated by that, but just remember that there is a child who is probably needing oxygen urgently, IV fluids urgently, and we will get to your child eventually.
Just unfortunately a little bit longer than any of us would like right now. Someone's asking, can you explain again, adults can also get RSV, and are there certain adult populations maybe who might be more at risk for problems if they get RSV?
Yes, adults can definitely get RSV. Often the symptoms adults are much milder, and even older children are much milder. We know that typically the more times you've had RSV, the less severe the symptoms are. You may not even really be aware that you have it. You may just have like a little sniffle, sore throat for half a day, something like that. Typically the older adults are the ones who are more at risk, elderly individuals, people who have chronic respiratory problems, so adults who have something like COPD, emphysema, those are adult populations who are a little bit more at risk.
Okay. Someone just asked, I noticed a cold sore on my son's lip. Could that be caused by a high fever?
Sometimes, yes, actually. You can get fever blisters. There's many things that can cause cold sores, but yeah, sometimes high fevers can give a child a fever blister. Commonly, there's a couple viruses out there that tend to cause them more than others. If it's just a simple cold sore, you don't really need to worry about it too much.
Okay. Yeah. And is there at any point where mom or dad might need to call the doctor
Yeah, so if we see cold sores and you have them all over your lips or maybe inside your mouth, sometimes kiddos could actually have a lot of pain with that and won't start eating. I usually say if you are noticing a significant outbreak of cold sores, definitely around the mouth or really inside the mouth, you should probably call your doctor. Sometimes there are medications that children need to treat that, and your doctor can better assess once they look at it whether your child needs that.
Okay, I think this has been great. Thank you. We got through everybody's questions. So just to wrap up here, Dr. Kaylin, what again are some things that parents can do to protect their kids and each other right now? And then also just to recap, when should they come to our ED? When should they call their doctor?
Okay, so the number one things parents can do to help protect their children are just making sure they're washing their hands and, try to keep your very small infant away from other sick individuals as much as possible. That is the number one thing you can do. If you're in a home with multiple children, common problem. Again, just trying to make sure everybody is sneezing into their elbow, coughing into their elbow, and washing their hands. And then what was your second question?
It's more when to call the doctor, when to
call the
try and manage at home, and when to come straight to us at Valley Children's.
So certainly, if your child just has maybe a low-grade fever, a cough, a runny nose, something that's really mild, but they're still acting like themselves, they're still drinking, they're still eating, that's something you can manage at home. You may be worried that it's RSV, but if your child is okay, it doesn't really matter that much whether they have RSV or some other virus, because they're doing okay. So it's really important to come in and see your doctor if your child is having severe coughing spells, turning blue around the mouth, having trouble catching their breath, if they are really breathing very, very fast, so it's almost like you can see their little ribs, showing every time your baby's breathing or using their little tummy to breathe and really working hard. Those are signs you need to be seen. If you're worried your child may be getting dehydrated, call your doctor. Check your child's diaper. How many wet diapers are you having per day? Those are all things to watch for. And if you're just worried about maybe a low-grade fever or something like that, you can absolutely call your doctor. But if your child is lethargic, is not responding, is turning blue around the mouth, is having significant trouble breathing, they need to come to the emergency room. If you have a child or an infant less than 2 months of age who's a temperature over 100.4, they need to come to the emergency room, or you can call your doctor if you can be seen right away. But in that case, if it's the middle of the night, you often need to come in.
Okay, thank you, Dr. Kaylin, for all of that information. And for those of you who are watching right now, thank you for tuning in. Valley Children's does have a lot of resources on our website. You can go to valleychildrens.org/RSV. So valleychildrens.org/RSV. There are a lot of there's a lot of great information listed there, including, as Dr. Kaylin mentioned, there's a great video from our partners at the American Academy of Pediatrics that we've posted on there that actually demonstrates what does difficulty breathing in a newborn look like. A 2 or 3-year-old can more explain and communicate that they're in pain or they're struggling, but for babies it's a lot harder. So there's a lot of information there, particularly for parents of infants, of very young infants, because again, that's a lot of what we're seeing. And also infants can get hit especially hard during this winter virus season. But Valley Children's is here if you need us. We just ask for patience if you have to go to our emergency department. But we, along with pretty much every other hospital, is seeing the same thing. But of course, we are here to answer your questions. Dr. Kaylin, thank you. Thank you. For those of you at home or at work, wherever you're watching, thank you as well. Stay safe, wash your hands, and stay home if you're sick. Bye.